A lot of athletes and active individuals complain of knee pain, and if you're one of the people that is struggling with knee pain, there are a lot of different things that you can do, but the first step is to manage the pain. So we here at Precision of Movement like to use different technology. So we like to use the Hypervolts. So a lot of the times what happens with knee pain is when you're overusing this muscle here, you can load the tendon down below here, or you can put a lot of pressure behind the kneecap. So the first step is to unload this area, and one way to do that is to use any kind of massage tool or foam rolling device to help unload this area. So there are muscles in the front, your quadricep muscles. That's the area you want to target to help unload this area. So if you do have a Hypervolt, grab one of these things, turn it on. I just use speed 1. It's plenty fast enough. And I try to imagine where the muscle is, trying to hit the bone, of course, and just try to gently put the pressure through the muscle and move up and down. I typically don't go too fast. Some people kind of move back and forth like this. I like to go slow and search for these trigger points, these gaps in the muscle. Those are the ones that tend to create problems. So just again, try to find some easy spots. If you're feeling a little bit of pressure, a little bit of sensitivity, that's a little bit of a good thing. So you can try to hammer that out a little bit. And I usually spend about 30 seconds to about a minute. You don't have to spend too much time on it. And like so, just follow the muscle belly, go for about a minute. You can go in the middle, you can go a little bit on the inside, and then you can also work a little bit on the outside, like so. Now let's say you don't have one of these, you can also use a foam roller. So, face down, same concept. You're trying to relax the trigger points in the muscles by just slowly moving through the range here. Now there's a lot of controversy as far as should I foam roll or does it even work? If you do have restrictions in your muscle quality in the fascial system, it is recommended to massage and really improve the circulation. So I found it to be helpful with that. A lot of studies do show that foam rolling does increase circulation, so do these percussive devices. So anything to help relax the area, to take the stress away from the source of your pain, can be really helpful. Now let's say you don't have a foam roller. Another cheaper option would be a tennis ball, and you can grab this from any local store. So just put it on the ground and find that nice tender spot that you want to release. And same thing, you can either lay on it for 30 seconds to about a minute, or just try to slowly move through it and try to see if you can breathe and relax. Breathe in through your nose, out your mouth, and again about 30 seconds to about a minute is plenty of time. And try to see and reassess how the knee feels afterwards. Again, this isn't a fix-all, cure-all type of thing. It's just one option out of many if you do have an issue with the kneecap or the front of your knee. If you want to also use ice or compression or a combination of ice and heat, that's also helpful as well.